OPB Podcasts.
From the Gert Boyle Studio, it's OPB Politics Now for Friday, October 31st. More than 750,000 Oregonians who fill their pantries thanks to SNAP, or Supplemental Nutrition Assistance Program, will be cut off on November 1st if the government shutdown continues. In Oregon, that's roughly 1 in every 6 residents. More than 200,000 are children. More than 130,000 are older than 65. This news has caused political reactions on the right and on the left, and many are worried about what will happen to the most vulnerable as a shutdown continues. We are here to break it down. Welcome to the podcast. I'm OPB Politics reporter Lauren Dake.
Hey, I'm OPB's food and agriculture reporter Alejandro Figueroa.
And I'm OPB's health reporter Amelia Templeton.
Hi, this is Lauren. I'm just jumping in to say this podcast was recorded moments before 2 federal judges ordered the Trump administration to use emergency reserve funds to resume SNAP benefits for November. There is still a lot we don't know, but keep listening to our show for what we do know. Alejandro, let's step back for a moment here and just explain how SNAP, which is a federally funded program, works.
Sure. So it's worth noting that people still call SNAP by its former name, food stamps. So we might kind of use that interchangeably because people still do colloquially. But SNAP is supposed to supplement people's food budget. And that is set, like how people participate is through an income threshold that's set by the federal government to determine eligibility for a lot of other government assistance programs. And that threshold is, it just varies by state. In Oregon, for example, a family of 4 making a monthly income of $5,000 or $5,000 a month could be eligible for that program. Usually, how it's worked historically is that the federal government provides the money and then states administer it. So things like figuring out who's eligible, doing the paperwork, that sort of thing. And the program has had sort of like different iterations over the last 80 years. But the modern version of the program didn't really come about until the 1960s during President Johnson's administration as part of the War on Poverty campaign.
Okay. For a lot of people, I mean, we've been talking a lot about this, but for a lot of people, this government shutdown, it's not an abstract political fight. I mean, it's really threatening the way they buy very basic grocery items like eggs or baby formula. You visited some food banks, which are all seemingly bracing for higher demand and shorter supplies. Give us a sense of what you heard from people.
Yeah, so I visited this food pantry in Portland last week. This was the day after the Oregon Department of Human Services sent out this announcement saying, or letting people know, hey, you may not get your benefits next month because of the federal government shutdown. And I went because I really just wanted to know whether people coming in for food were also receiving SNAP benefits and whether they received any notice from the state. And by then, because it was the day after the federal government or the state government was just starting to let people know, some people didn't know that this was happening, and some people did. And maybe they just heard it in the news. But across the board, what I heard also from the people that run the food banks and the food pantries was that they are expecting to see more people and are trying to figure out where to source more food from. I spoke with Ryan Sherman, who is the project coordinator at the Northeast Emergency Food Pantry, which is the pantry that I visited last week. And he pointed out why this is not sustainable.
The pantry system is supposed to be an emergency solution for people falling through the cracks. If they remove the whole food safety net, the pantry system is not going to be able to handle all of the people who need the food. It's not something that people are supposed to be relying on permanently to feed their families.
Yeah, and I mean, you hear this a lot, that the food bank or food pantries, they're the safety net before the safety net. So, I mean, it's really something that people often say a lot, that this is not designed to be like this permanent source of food for folks.
And is food pantry food, it's free, right?
It is.
Okay.
I mean, it depends. Some people, how they do it is they'll go to a pantry and you can choose and pick what you want. So it'll be like a grocery style pantry. Some places just do food boxes. It really depends.
Okay. Well, I said at the top of this podcast that SNAP feeds more than 200,000 children. And I mean, that's a very striking number. That's more than the number of people who live in the entire city of Eugene, the entire population of Eugene. So a lot of children really rely on this benefit in the state. Can you tell us, for Oregon, how much this usually provides for families? Like, what are the monthly benefits? What kind of food do they get from these benefits?
Yeah, I mean, the answer sort of depends on a family's financial situation. So the average SNAP monthly benefit per household in Oregon is around $300. For single people is way less than that, sometimes about half. I mean, I've heard some people, if they fall under the category, it's called able-bodied adults with no dependents. I mean, I've heard some people in that category get as little as $50 a month for that, which again, I mean, this is supposed to supplement their food budget. But people certainly receive more during the pandemic when the federal government was giving out, they call it like an emergency extra payments just to get people through the month. But now, I mean, there's so many changes to that program that you're seeing. You have the Big Beautiful Bill, which basically makes it harder for people to qualify for SNAP. When that happened, Republicans said that the program is or was or still is poorly managed, wasteful, and that people who are on it shouldn't be on it. There's a laundry list of changes that the bill made to that program, but I think one of the biggest ones for families is that parents with children age 14 and 18 must now meet work requirements, whereas before that was not the case.
I know you were sitting at your desk yesterday because I walked past you and you were looking at a lot of maps and just digging into demographic data. Did you find anything interesting?
Yeah, I mean, you and I were talking about this. We wanted to get a better picture of who this will affect the most and where in Oregon. And something that I found that was I felt was kind of interesting was that the counties that use food stamps the most were Josephine, Malheur, Klamath, and Jefferson County. So I found that those counties, over 40% of households in those counties participated in that program. So very close to half of the households in those counties. So I think that kind of checks out with this notion that rural communities depend the most on this program. And I just think that it's worth saying that in these communities, this program not only alleviates poverty for people, but it also supports these smaller rural economies where there already isn't, that much industry to begin with.
Okay, well, there's also a lot happening on the political front here. Several Democratic governors, including Oregon's Governor Tina Kotek, are suing the Trump administration, saying the SNAP cutoff is unnecessary. They're saying it's illegal. We have heard statements flying into our inbox from both politicians on the right and the left voicing concern. GOP gubernatorial frontrunner Christine Drazan came out with a statement pushing for urgent action. She noted in her campaign speech that she was on food stamps as a child. And we're just seeing a lot of states with both Republican and Democratic leaders trying to step in and fill the gap where the federal government is shutting these benefits off. Kotek said she is sending $5 million directly to Oregon food banks to help. In Washington, Governor Bob Ferguson said he's going to spend $2.2 million a week. So depending on how long the shutdown lasts, that could amount to a hefty sum. Alejandro, I've been trying to get a sense of just the total cost of SNAP in Oregon. I'm curious what Kotek's $5 million to food banks will do or how long that will last.
So on average, Oregon, or I would say the federal government, sends $142 million a month into people's account for food on SNAP for Oregon. Obviously, $5 million is not compared to that. But I do think it's worth saying that the food banks, have the purchasing power to source food in bulk and then distribute it to their regional partners. I think there's this stat on the Oregon Food Bank's website that says for every dollar that they get, it generates the equivalent of 3 meals of worth of food. And I think I said this earlier that food banks and food pantries are the safety net below the safety net, and that relying on this permanently is not sustainable. And it is true, a lot of people say that, but I think it's also worth saying that food banks are still going to have food, right? But if you see this increase in demand, it certainly means that there's going to be less of it for individual people and for families.
Okay, well, thanks. Amelia, you had some thoughts on this?
This is also a program that serves a lot of elderly people and a lot of people with disabilities. And, those are people living on fixed incomes, a certain amount a month, who really need every dollar to stretch as far as it can. And, one thing I heard when I was out in the fields a few months back talking to people about SNAP benefits from these older adults was, look, if I lose these benefits, I'm going to be forced to choose between housing and food. And at the end of the day, I can't survive without food. And if I'm paying more for food, there's no way I'm going to be able to make my rent this month.
Yeah, certainly some tough decisions. All right, let's zoom out on the SNAP issue here for a moment and look at what's at the center of this entire shutdown. Democrats are saying they're not going to reopen the government unless Republicans agree to extend some subsidies for people who get their insurance through the Affordable Care Act. Congressional Republicans are split on what to do about the credits. Some want to let them expire. Others worry that will mean what that could mean practically and politically. Amelia, just can you help us break this down? What exactly expires at the end of this year?
Yeah, it's something called enhanced premium tax credits, which, I wouldn't expect anyone to know what that means. Basically, it's a big government subsidy that helps bring down the cost of buying a private health insurance plan for people who need to buy their insurance for themselves and their families or for a small business. And I think the way that I think about it is that most working people are not paying anywhere near the full monthly cost of their insurance plan. Maybe you're chipping in $100 a month for your premiums or $300 a month, but behind the scenes, your employer is probably paying another, $600 to $1,000. And so most people are not used to seeing or thinking about the full cost of a health plan. And that's really the problem that the Affordable Care Act was trying to solve. What happens for all the people who don't have, an employer sharing the cost or who aren't on a fully government-funded program like Medicaid? All of a sudden for that group of people, the cost of buying health insurance can be up there with your rent or your mortgage payment. So when the Affordable Care Act was passed, it created these subsidies where the government sort of steps in and acts a little bit like, the employer, sharing the cost of those monthly payments, bringing them down. And the subsidies work on a sort of sliding scale. They cap the amount of your income that you have to spend on health insurance. So people with higher incomes have to contribute more to their monthly premiums. People with lower incomes have to contribute a smaller amount or nothing at all. In 2021, and then again in 2022, the Democrats in Congress voted to provide much larger subsidies to all of the households that were eligible to get insurance through the ACA. And they also eliminated the upper income limit on who could qualify for a subsidy. And what happened after that was pretty interesting. It actually had a huge impact on enrollment in the marketplace. The number of people getting ACA insurance roughly doubled from about 11 million people to about 24 million people nationally. And those subsidies are those enhanced subsidies, the sort of bigger, more generous subsidies that actually helped bring a lot of people into the marketplace for the first time. That is what is set to expire at the end of this year.
Whew, okay, so tell us who in Oregon is going to be impacted.
Very few people in Oregon comparatively will be impacted by this directly. So most Oregonians are getting their health insurance either from their employer or from Medicaid, that's government insurance for very low income people, fully paid for, or Medicare, the program for older adults and people with disabilities. There's only about 3% of Oregonians who are actually buying private insurance plans from the Affordable Care Act. Most people will not feel any direct impact from these subsidies expiring. But there's this subset of people who will lose these subsidies, and for that group, it's a really big deal. And it's a really interesting group of people. It's primarily, a lot of working people, a lot of independent contractors, basically, musicians, farmers and ranchers, lawyers, dentists. Those are both people, I've spoken to about this, but also KFF, which is a national nonprofit that does healthcare research, has looked at the most common professions that get their healthcare through the ACA, and those are some of the types of work where people tend to do this. There was another analysis by the Oregon Journalism Project, which found that counties that have a lot of sort of outdoor recreation, seasonal work, like Deschutes, Hood River, and Wallowa County, are also relatively heavily impacted. And for people who are seeing these subsidies expire, it means that, you could go from paying, ballpark $500 a month for a plan that still won't kick in and cover any of your healthcare costs until you've spent, a $8,000 deductible to suddenly having to pay, $1,000 a month for that same plan that's still not giving you very generous coverage. So it is a really big financial hit for people who are affected by these expiring subsidies.
Yeah, that sounds very daunting, but you mentioned it is a pretty small percentage of Oregonians, 3%. Is that right?
Yeah, that's right.
So how hard will, how does that compare to the average American nationwide?
It's about half of what we see nationwide, which means Oregon as a state is going to be less impacted by this than many other states. And what's really interesting is that the loss of these subsidies is going to hit particularly hard people in a group of southern states that were won by President Trump in 2024, states like Texas and Florida. Those are places where these enhanced tax credits led to a ton of growth in the number of people enrolled in healthcare. And so I think that's one of the reasons why we're seeing some Republicans in Congress, like Marjorie Taylor Greene, saying Republicans actually need to come up with some solution to this problem. They can't just let people kind of fall off this cliff where their healthcare costs skyrocket at the end of the year. On the other hand, people like House Speaker Johnson have criticized this program for how expensive it is. It would add to the deficit $350 billion if these tax credits, enhanced tax credits, are extended. And he has essentially called this program a sort of handout for insurance companies. So, you have this political dynamic where on the one hand, there are a lot of constituents of Republicans that are going to be directly impacted by this in important states like Florida, Texas, Georgia. And then on the other hand, it gets at this sort of like core disagreement within the Republican Party over what to do about healthcare.
Okay, before we wrap this up, we should mention a federal judge is expected to decide at some point, possibly today, likely today, whether the Trump administration must continue to fund food stamps. So at any moment, all of this could change. But right now, we do know roughly 42 million people are at risk of not having enough food if something doesn't happen, and we will keep covering this. Alejandro and Amelia, thank you so much for joining me.
Thanks for having me, Lauren.
Thanks, Lauren.
This week's episode of OPB Politics Now was recorded in the Gert Boyle studio. It was produced by Andrew Thien. Our audio engineer is Nalene Silva. Our music comes from Audio Network. We will be back next week with more political news from across the Pacific Northwest. Until then, you can find all of OPB's reporting at opb.org.